This podcast is for educational purposes only and is intended for medical professionals. It does not provide medical advice or establish a provider-patient relationship. Always consult a qualified healthcare provider for medical concerns. While we strive for accuracy, medicine evolves, and listeners should verify information with trusted sources. Views expressed are personal opinions and do not reflect any organization's policies. Listener discretion is advised, and we assume no liability for reliance on this content. All rights reserved. Unauthorized use is prohibited. Welcome to Pathora, Medicine in 5 Minutes, where we simplify big medical topics quickly, clearly, and maybe even a little fun. Today, we're talking about diabetes, the sugar problem that just won't quit. Whether you're a medical professional, a resident, or just medically curious, stick around as we cover what it is, how to diagnose it, and how to treat it, all in under 6 minutes. Let's start with the basics. Diabetes mellitus is all about high blood sugar thanks to either insulin deficiency or insulin resistance, or both. It's like having the keys to unlock sugar into cells, but either the keys are missing or the locks are jammed. There are 2 main types of diabetes. Type 1 diabetes. This one's an autoimmune attack on pancreatic beta cells, leaving little or no insulin production. It often starts in childhood or adolescence, but adults can get it too. These patients are insulin dependent for life. Type 2 diabetes. This one's all about insulin resistance and usually hits later in life, although younger cases are on the rise thanks to obesity and sedentary lifestyles. It's often linked to metabolic syndrome. Think hypertension, high triglycerides, and central obesity. And let's not forget gestational diabetes, which shows up during pregnancy and increases the risk of type 2 diabetes later. Now for the symptoms. Diabetes doesn't hide well. Patients come in with the 3 Ps: polyuria, peeing too much, polydipsia, drinking too much, and polyphagia, eating too much, often with weight loss in type 1 and weight gain in type 2. But sometimes diabetes is silent, only showing up with complications like blurred vision, nerve pain, foot ulcers, or heart attacks because it loves to play the long game. So, how do we diagnose it? The tests are straightforward. Fasting glucose 126 milligrams per del measured after an 8-hour fast. Random glucose 200 ml with classic symptoms. Hemoglobin A1C 6.5% reflects 3-month sugar control. Oral glucose tolerance test 200 milligrams per del after 2 hours, mostly used for gestational diabetes. And don't forget to screen high-risk groups, anyone who's overweight, has a family history, or shows signs of metabolic syndrome. Now let's talk treatment, because managing diabetes is all about control. For type 1 diabetes, it's all about insulin replacement. Start with basal bolus therapy, a long-acting insulin like glargine combined with rapid-acting insulins like Lispro for meals. Insulin pumps are also a great option for tighter control. For type 2 diabetes, step 1 is lifestyle changes. Think diet, exercise, and weight loss. Even 5 to 10% weight reduction can make a big difference. Next come the medications, and there are a lot of options. Metformin, first line, inexpensive, and works by reducing hepatic glucose production. Watch out for GI side effects and rare cases of lactic acidosis. GLP-1 receptor agonists like semaglutide and liraglutide, great for weight loss and cardiovascular protection. SGLT2 inhibitors like empagliflozin and dapagliflozin help with glucose excretion in the urine and protect against heart failure and kidney disease. Just watch for UTIs and dehydration. DPP-4 inhibitors, like sitagliptin, which are weight neutral but less effective for major outcomes. Sulfonylureas, like glipizide, which stimulate insulin release but carry a risk of hypoglycemia. Insulin, used in advanced cases or when oral agents fail. Managing complications is just as important as controlling blood sugar. Keep an eye out for neuropathy. Treat with gabapentin or per retinopathy. Screen annually and refer to ophthalmology. Nephropathy. Check urine albumin to creatinine ratios and use ACE inhibitors or ARBs for kidney protection. Cardiovascular risk. Manage lipids, blood pressure, and use aspirin for secondary prevention. Acute complications are emergencies. DKA, diabetic ketoacidosis, presents with abdominal pain, vomiting, fruity breath, and metabolic acidosis and needs IV fluids, insulin, and electrolyte correction fast. Hyperosmolar hyperglycemic state, HHS, seen in type 2, requires aggressive hydration and glucose management too. To wrap it up, diabetes is a lifelong condition that needs early diagnosis, personalized treatment, and ongoing monitoring. Whether it's insulin for type 1 or medications and lifestyle tweaks for type 2, the goal is the same: control blood sugar and prevent complications before they start. That's it for today's episode of Pathora Medicine in 5 Minutes. Don't forget to subscribe, share, and leave us a review. Thanks for tuning in, and as always, stay curious and keep learning.